Good evening. This is the special coverage of the coronavirus crisis using the combined forces of News 5 and Signal TV's One News, Radio 5, and 1PH. Informal workers affected by the enhanced community quarantine across Luzon may get a temporary job from the Labor Department. Secretary Silvestre Bello III says vendors, public transportation drivers, and the like will receive minimum wage by disinfecting their own houses, schools, and government buildings. According to Bello, interested workers can go to their barangay officials who will then submit their names to the DOLE. Earlier, we reported about how there is an ongoing priority-setting mechanism in some hospitals admitting COVID-19 cases. And to get more clarity on this issue, we have with us on the line Health Secretary Francisco DUQUE. Secretary DUQUE, thank you for joining us.
Yes, good morning. Good evening to you, Ed, and to your viewers.
Good evening, sir. Sir, just some clarity kasi a few hours ago we interviewed or we talked to Dr. Carl Henson. Siya yung head ng epidemic reaction team ng Medical City, and he was telling us na yung mga some COVID positive patients who exhibit na lang mild symptoms have been sent home for home quarantine.
Tama yon. Because we don't want to overwhelm, we have to be more focused on the highly vulnerable group, which is the elderly.
The elderly.
The elderly. Not only the elderly, but elderly, further qualified, elderly with pre-existing medical conditions, hypertension, diabetes, cancer. So all of these that will make the COVID infection much more complicated and extremely serious.
Yes, sir. So in a way, it's parang triage. It's prioritizing who needs to get medical attention at the soonest time.
Exactly.
Yes, sir. So, sir, it's a policy that began today. Is that correct? And is this
I think
policy
about last week pa eh.
Okay.
If I'm not mistaken, the algorithm was introduced last week or early this week. Let me check on that because I've been very busy orchestrating the task force. So sometimes these granular issues are best answered by our more technical undersecretaries with more technical know-how.
Yes, sir. Well, we understand, sir. But at the same time, sir, I suppose, nabanggit rin kanina ni Dr. Henson na in some cases merong discrimination doon sa mga local communities when they find out na merong COVID positive na nakauwi ng bahay. Again po, if we go through the protocols, what are the best ways by which we can ensure na hindi po kumalat yung sakit when a COVID-19 patient, positive patient, is sent home?
Well, the monitoring system has to be adopted. The temperature monitoring, the mild symptoms, if there are signs of aggravation or deterioration, then they are contacted and they contact their city health office that does the monitoring. So meron ng ganun na sistema on the ground, and the mild cases of COVID are made to just go on a room quarantine in their rooms, and although I'm not very clear kasi hindi dapat sila magkaroon ng close contacts with elderly inside the homes.
Of course po, yes po.
Kasi mahirap nga yung elderly, di ba? Sinasabi natin that's the vulnerable group.
Or with medical conditions. Or with medical conditions. Yung existing medical conditions.
Exactly. Oh.
But sir, I suppose at this particular point, kailangan talaga ng iba yung pag-iingat yung mga pamilya that are handling these COVID patients. Yung monitoring po, is there somebody on top of the monitoring of these people who are now at home?
Yeah, there's an agreement with the local chief executives that their city health office does the monitoring. Yung iba nga sa San Juan, meron pang live Facebook, parang chat sila na the patient is being monitored, making sure that hindi sila lumalabas, they're just staying in place so that na monitoring ang end goal, and that they eventually improve.
Ano yun, sir? Parang may webcam na nakatutok sa kanya 24 hours
Parang
para...
gano'n, yes, yes. Parang gano'n yung isang kurento sa akin ng isang lady, elderly, from North Green Hills. I can't tell you the name.
Yes, sir. Of course, sir.
So,
Yes, sir.
oo. Kasi for a while, merong nag-monitor sa kanya na may police, may tent na binabantayan ng police yung bahay. So, nakiusap na parang feeling nila they're being treated like criminals daw. So, nakiusap. So, nagkaroon ng arrangement na. But I didn't know that the arrangement was already in place na may parang live chat na the monitoring team is actually able to see what the lady is doing in her house.
Yeah, that's a fascinating way of monitoring.
Yeah.
Via webcam.
So, that's right.
But Secretary Duque, of the 202 that we have total na confirmed positive na COVID cases, would you know how many are already at home and versus how many are still confined to the hospitals?
Well, my internet kasi so bad, hindi ko makita. Hindi ko ayaw. So,
It's okay, sir. No, even a ballpark figure, or at least a percentage, even if it's not an exact number.
I really can't say. It's hard. Siguro by tomorrow I'll have a clearer picture of the home quarantine versus the hospital isolation rooms of the positive COVID
Yes,
patients.
sir. Well, just to assure the public, especially the communities that surround people who have been sent home, even though they're COVID positive, government is on top of this. Government is monitoring closely.
Yes, we are monitoring closely, and in fact, we have set up our 1555 easy access number with our call center agents 24/7. So they're monitoring, and I will have to get the report tomorrow early morning of today's queries and what were answered, who were referred, how many were sent to which hospitals, which facility. So the system just has to be broken in. So hopefully it will be a more smooth operation.
Yes, sir. Sir, I'm certain you've already heard about what Quezon City government has already done. They've declared hot zones in several barangays in the area, specifically mga bahay ng ilan sa mga COVID-positive patients. We don't know lang if the patients are there themselves or if the patients are in the hospitals. How do you view po yung decision ng QC to have this, what they call the extreme lockdown?
Well, that's okay because the end goal is containment, di ba?
Opo.
The end goal, the end goal is elimination of the virus, but the how is the containment. So this is not surprising because we are all Luzon and NCR and all the neighboring regions are in a extended quarantine. So it's par for the course. That's the way it is.
Yes, sir.
Lahat naman tayo, di ba? Naka-quarantine yan. Like we're all persons under monitoring.
Yes, sir. Well, Mr. Secretary, we've also been getting numbers along the way. See, Dr. Troy Hepte said that we expect an increase in the number of COVID positive that we have in the country in 2 to 3 weeks. I suppose that's because of yung pagbabantay nga ng 14-day period. At the same time, the number has been floated around 75,000 cases possible in the Philippines in 2 to 3 months. Ano po? Are these estimates correct?
No, it's just a modeling. It's far from perfect.
Opo.
It's a modeling exercise. It's not necessarily what's going to happen, but it's better to put in mind that there is that possibility.
Opo.
Whether it will probably happen, that's something else. It's a possibility, yes. There are many possibilities now. But come to think of it, the measures that we have implemented are actually reflected from the lessons that we learned from Wuhan, from Italy, from Singapore, where, we know that Italy's lockdown was superficial, That is why they failed to contain it, thus the relatively high numbers
Apo.
registered. But the Chinese experience, remember that China implemented lockdown on January 23rd.
Yes, sir.
And
A
they
massive
kept
lockdown.
getting their cases even increased and peaked sometime February 12, 13, 14, and then suddenly there was already a downtrend that they experienced. So we also see us as just because we impose a extended community quarantine doesn't mean that the day after you'll see now less cases. That's
Yes,
not
sir.
the way it happens.
Yes,
It
sir.
will still continue to rise until hopefully it plateaus and then starts going down.
Yes, sir. But, sir, the 75,000 model that we were looking at, is that premised on us not doing anything, or is that already premised on the measures that we have put in place?
No, the premise there is business as usual. You're not doing anything.
Meaning it was a pre-quarantine model.
Model, that's right. Because the objective for imposing this lockdown or extended community quarantine is really to delay the epidemic peak. We don't want the peak to go past the health system's capacity to manage the cases. So
Yes, sir.
the idea is yung graph mo, kung mataas siya, no, ibig mo you want to flatten that curve. Lessen the epidemic peak, extend the curve. Okay, so that mababa siya, lower than the level of your health system's capacity to manage.
Yes, sir.
Kasi kundi ma-overwhelm tayo, di ba?
Yes, sir. We understand,
We'll be
sir.
so overwhelmed.
Sir, but with
I have a graph of that, and next time siguro I should show you.
Sige,
para
sir.
mas madilim.
Sir, but with the quarantine already in place, do we have any model for the quarantine as it is already in place? Any figure or any estimate?
Wala pa because like
only day
200
two.
plus tayo ngayon.
Apo.
202, mga ganun yata. 202 nga ba? Nawawala. Yeah. So, we'll have to see. Hopefully, the new cases registered each day plateaus, or if it does increase, it will increase by increments, small increases, and then slowly, hopefully, there will be a downtrend. So, it's premature to judge anything now,
Yes,
to
sir.
make conclusions.
Mr. Secretary, if I may, just one more question.
Sure.
It's day 2 already of the national quarantine. May we have your assessment as the person in charge of the country's, you might say the country's health, as the person in charge of the country's health, your assessment health-wise of how we have done the quarantine?
Well, in terms of the quarantine, generally, I think, except for some, difficulties encountered, like the transport of health workers. Yesterday, that was a big issue, and hopefully now that has been substantially addressed. So tomorrow we'll find out again. So we continue to monitor, but by and large, mukhang umo-okay naman. So we'll just have to see the figures as or the metrics of whether this quarantine is taking off relatively well.
Yes, sir. But at this point, do you see any possibility of the quarantine being further expanded and being further enhanced or made stricter?
Well, there's always that possibility. The important thing is we already have the template for Luzon, so that in case the triggers of expanding extended community quarantine is there or are there, then it will be easy to cover Visayas and Mindanao eventually.
Yes, sir.
But we'll wait for the more objective triggers of untraceable community transmission of COVID infection.
Yes, sir.
So we're continuously reassessing the situation.
Yes, sir. Sir, by that, I suppose you mean that what would trigger an expansion would be signs of community transmission in other regions outside of the quarantine area?
Exactly.
Okay, maraming salamat po, Health Secretary Francisco Duque. Again, sir, thank you for taking our
Thank
call.
you. Thank you for the opportunity
Thank you, sir.
on behalf of the DOH. Thank you.
A community quarantine will be imposed across the Davao region starting 12 a.m. on Thursday. To give us more details on this, we have on the line News 5 correspondent Jem Abansenya. Jem, kamusta kayo dyan?
Bok, patuloy nga yung pagdagsa ng mga biyahero papasok ng Davao Region ilang oras bago nga ipatupad itong region-wide lockdown. At inuulit nga natin, alas 12:01 ng madaling araw mamaya ng March 19 ay sarado na ang lahat ng entry points ng Davao Region at epektibo yan sa loob ng 14 days. Pero bukas yung exit points at bukod nga sa land travel, suspendido rin yung sea and air travel. At kasabay ng implementasyon ng region-wide lockdown ay ang paglilift o pagdidismantle ng localized lockdown sa loob ng rehiyon. Pero ayon chairman ng Davao Region COVID Task Force na si Mayor Sara Duterte, ang maaari lang na bumiyahibok within Davao Region ay itong ang mga trabahante at yung may mga valid reason at essential needs. So ibig sabihin, kung ikaw ay from Davao City at pupunta ka ng Tagum City para mamasyal lang ay bawal, hinaharang na ito dun sa mga checkpoints within the Davao Region. At Bok, simula rin bukas ay mag-i-impose na ng mas pinalawak na liquor ban dito sa Davao City. So yung bagong liquor ban ay 5 p.m. to 8 a.m. na. Bok?
5 p.m. hanggang 8 a.m.?
Yes, Bok.
So alas 5
Kasi,
pa lang, bawal na ang inom?
Yes, Bok. Yan na nga yung ipapatupad rin bukas kasabay nga yan itong pagla-lockdown ng region-wide dito sa Davao Region.
Mm-hmm. Okay, Jem, balikan ko lang ha. So ang lockdown magsisimula in 3 hours kasi alas 9 na halos. Tapos ang pinaka-tinatamaan niyan ay yung entry doon sa Davao Region. Yun talaga napakahigpit. Yung exit pwede mong gawin, pero pag lumabas ka ng Davao Region, kailangan ka magpa-quarantine ng 14 na araw ba bago ka makapasok ulit? Tama ba?
Bawal na talaga, Bok. Kung lalabas ka ngayon ay sa April 1 pa.
Okay. Isang buwan ka na, makabalik.
Oo, April 1 na ng 11:59 ka pa pwede ulit makabalik dito sa Davao, Bok. And may changes, Bok, kasi kanina napag-usapan natin yung about dun sa initial proposal na yung mga cargo vehicles, Bok, na papasok ng Davao Region. Initially kasi yung sinabi ni Mayor Sara sa initial interview niya kaninang umaga ay di ba, i-discarga yung mga laman ng cargo vehicles at ililipat. Pero ngayon, dun sa inilabas na nilang guidelines, ay pwede nang makapasok, Bok, yung cargo vehicles, yung mga delivery trucks, pero yung driver lang, yung pwedeng makapasok. Yung kung meron mang assistance, yung mga helper ng truck, maiiwan sila dun sa checkpoint at hihintayin na lang nilang bumalik ulit palabas yung kanilang delivery truck.
Okay, so yung piloto lang talaga yung papapasukin, siyempre pati yung sasakyan.
Yes, Bok. And kasama nga dito, pag sinabi yung mga cargo vehicles, yung may mga kargang mga baboy, pwedeng makapasok, pwede nang makapasok sa Davao Region.
Yeah. Well, Jam, that does seem to make sense kasi kung magdidiskarga ka at magkakarga ka sa kabila, yung pila niya ng sasakyan, haba talaga yan.
Yes, Bok. And bukod nga doon ay syempre exempted pa rin yung personahe ng ASP and PNP na makapasok sa Davao Region. And the rest, bawal na talaga, Bok, na makapasok ulit sa Davao Region.
Nabahala rin ako dun sa 5 p.m. to 8 a.m. na likorman.
Yun na nga, Bok, at medyo kumakalat nga sa mga Facebook ng mga taga Davao City na baka daw bukod nga sa mga pagkain ay mag-hoard na rin ng mga ng mga liquor, mga alcoholic drinks dahil nga sa liquor ban.
Huwag kayo mag-panic buying dyan ng alak. Sige, maraming salamat, Jem Abansenya, reporting from Davao City. A Filipino has been tested positive for COVID-19 in Greece, the Foreign Affairs Department confirms. The Filipino is said to be exhibiting mild symptoms and is under home quarantine in Athens. The DFA adds that the embassy continues to monitor the situation of all Filipino nationals in Greece. There are 387 COVID-19 cases in Greece with 5 deaths. Over 10,000 overseas Filipino workers bound for the Middle East are stranded in Manila. This was after countries like Saudi Arabia, Qatar, and Kuwait have banned all incoming passengers except their own citizens and diplomatic staff. The Labor Department will give 10,000 pesos as financial aid and plane tickets for those who may wish to return to their provinces for the meantime. The Philippine offshore gaming operations inside the Clark Freeport zone are suspended following following the government's declaration of an enhanced quarantine in Luzon. In a statement, the Clark Development Corporation, or CDC, says only employees in specific business enterprises, such as workers in the food sector, will be allowed to and from the free port. The move is in accordance with the guidelines for the community quarantine issued by Malacanang. And that's the latest on the enhanced and expanded community quarantine in Luzon. For more updates, follow News 5, the Philippine Star, and Business World Online. I'm Ed Lingao. We are One News.